Hey there, everybody. Today we wanted to have a conversation and just chat about health insurance, because we get lots of questions about it, specifically about supervisors, reaching out, asking, hey, are we entitled to health insurance plans paid for, entirely or in part by the township?
First of all, health insurance for supervisors is a complicated issue. So complicated that we actually have a handy little brochure that goes into details about that and about what I'm going to just give an overview today. We always start with the question of, is the supervisor also an employee of the township, or are they just a supervisor? Because it makes a difference.
Absolutely.
For determining whether they're entitled to, eligible for health insurance. So if a supervisor is a township employee, they then fall under the same rules as the other township employees. So if the township has a policy that it provides township paid health insurance to all employees that work 35 hours a week, and this supervisor also works as an employee 35 hours a week, then they're entitled to participate in that township paid health insurance at the same terms and conditions as the other employees. If they work less than that amount, for example, somebody works maybe 10 hours a week or on an as-needed basis, and all other employees are required to work a certain number of hours, and they're not meeting that, then they cannot participate as an employee on that insurance plan.
Right, because it can't unfairly, favor the supervisor as an employee over the other employees for that.
And that's very clear in the township code that the supervisors can't be treated better than the other employees of the township.
So if they're not an employee of the township, what do they need to do to enact a policy that covers non-employee supervisors?
In order for a non-working supervisor, just a supervisor, to receive township paid health insurance, there needs to be a policy in place before that supervisor began their current term of office. Sometime in the past, either through a township meeting, in the minutes, or a separate policy, the Board of Supervisors had to determine that they were going to offer that benefit to supervisors who are not employees of the township at the township's cost. They could decide just to pay for a township supervisor themselves. They could also pay for the family to participate in that plan as well. But that policy has to be in place before they began their term of office, because under the township code, it's treated as if it's part of their compensation.
Right.
And you can't increase or decrease a township supervisor's compensation during their term of office. So if that policy was in place, and the supervisor who's interested, it was before they began their current term of office, they are eligible to participate, and they would simply need to present a letter requesting participation at a township meeting, and they would be entitled in that situation to participate. If maybe a policy had been put in place, but it was during that supervisor's current term, they're not eligible at this time. If no policy had ever been adopted, then the current supervisors are not eligible to participate. And the other question is, does PSATS provide health insurance? And the answer is yes. Through the PSATS Health Insurance Trust, we do have a plan. We do provide a variety of different plans of health insurance and other types of insurances and retirement benefits.
Well, if you have any other questions about health insurance or really anything else under the sun, feel free to reach out and give us a call, and we'll address them as they come in.
Thank you for joining us.
Thanks.